here to shuffle up the deck. You'll probably think I'm famous because I got a blue check. I remember playing ball.
Alright, I'm here with Chris Chapleau, my health and fitness guru. What we're going to talk about today is injury I have on my elbow through overuse and through hours on the tennis court. I get pain in the inside of my elbow, and it sometimes goes a little bit higher, but generally from the beat up I get a lot of pain, sort of touch, and it gets a little bit achy too. So Chris, what's the injury that I have?
So what that commonly is called, it's on the inside of the elbow, the medial, what's called the medial epicondyle. It's a bony prominence here. The common term which people can recognize this issue is called golfer's elbow. However, you're a tennis player, a tennis pro, and it can happen to anyone who is, for lack of better words, over-gripping. Our wrist flexors and finger flexors are located in the forearm, and when we are grabbing a tennis racket or a golf club for that matter, it will often be overused, and the tissues in that area of the elbow will rub over that bony prominence. And so it should be, here it's all puffy, and I'm sure it's tender. What we would usually do at this point, since you've already have it and it's in that inflammatory cycle, we want to break that. So of course at home you want to ice it, but also other important things that you can do at home is mild massage. Self-massage in this area here, the underside, the flexor side of the forearm.
What's the difference between the golfers and the tennis elbow? Are they the same set of muscles, or?
It's different sets of muscles. The golfer's elbow is more related to, as I mentioned, the wrist and finger flexor muscles. And the golfer's elbow is from overextending. Our extensor muscles aren't quite as strong as the flexor muscles. However, they can also be overused, and then that is called tennis elbow, and that's lateral epicondylitis, where the lateral epicondyle here becomes inflamed. Other things that can be used when it's at this stage is my trusty shockwave machine, which is like a glorified massage machine that can break down adhesions, tendinopathies, any type of myofascial adhesions. Also, acupuncture is fantastic for the healing process, and also releasing some of those tight, overburdened tissues. Yeah.
So that's what we're going to do today. We're going to do the shockwave therapy.
What we're going to do is we're going to apply the gel. So the area that's going to be worked on is this area of muscles that flex the wrist, the fingers, and also are ulnar deviators. So I'm going to apply a little gel, ultrasound gel here. I also use castor oil. Can make the muscle a little more supple. Okay. So again, my goal here is to release any tension and any adhesions that develop within the myofascia. And you can feel that this area is extremely tense, and you can feel tight bands of muscle. So I'm going to work over that area. also has other. It also speeds up cellular metabolism. Helps with dilating the vessels in this area. It will also cause edema and some fluid to build up in the area. That's what's going to trigger the body to help heal the area. So don't be alarmed if it's a little puffy or actually even tender after the therapy.
Okay, after the treatment, my arm feels a lot less pain. So where it was sort of touch, I can touch now. The treatment itself didn't hurt. It felt like a little jackhammer
Yeah,
as it was
that's what
smacking,
it is. Yeah.
and that's pretty much all it is. The muscle feels a lot looser now, so it feels more flexible.
Good.
What should I be doing now after the treatment?
Okay, so the area here is a little puffy, a little swollen. What the shockwave is just a catalyst for your body to do what it ultimately does and to heal itself. So we gave it a little nudge. So it's going to be a little puffy, it's going to be a little sore. You might even feel that into tonight and tomorrow, but I recommend not using ice. Let the body do what it does and heal. Again, it depends on how acute this issue is, or if it's more of a chronic issue. It will dictate the series of treatments going forward. Okay, but I've treated people where, in your case, this is an acute issue. It just started happening, so 1-2 treatments might do the trick. But that's what I suggest to do, is not use it. Try to avoid doing what caused it in the first place. So if you can, not play tennis tomorrow and within the next few days. Let this recover.
Yeah.
And then we could think about, you'll talk to me between now and sometime next week.
So it should be probably once a week that you get
Yeah,
the treatments?
once a week, minimal, if not twice. But once a week can do it, sure.
Okay.
Yeah.
And generally, how many times would you have the treatment for a first-time injury?
Again, it depends on how long you've had it before you've come to see me. I would say, again, for you, maybe 2 or 3 treatments should do the trick. Yeah.
Awesome. Thanks, Chris.
Thank
Thanks,
you.
guys. We'll talk to you soon.